The HSE state that there are 20,000 estimated annual new cases of self-reported breathing or lung problems caused or made worse in the workplace. I'm here at Full Support Healthcare in Northamptonshire to meet the RPE expert, Brian Lavell. Brian is an RPE specialist and he's going to give me an insight into how Full Support Healthcare are leading the way in training and education of RPE within the NHS. So Brian, I'm told you're a bit of an RPE specialist. Just explain to me, what is RPE?
RPE is respiratory protective equipment. It's used by the workforce to protect themselves against airborne hazards in the workplace. So for instance, in healthcare, you would use a respirator mask to protect the healthcare worker against patients with a respiratory virus. You may use it in industry for people to protect themselves against silica dust or asbestos, or even welders would use respiratory protective equipment, again to protect themselves from the smoke of the weld.
You work a lot within the NHS. How does that fit in with RPE?
Okay, so anybody in the hospital that may encounter a patient with a respiratory virus, for example, any healthcare worker that may be dealing with chemical hazards, it's essential that fit testing is performed because each device may not fit everybody, so you have to establish that that device fits by performing a fit test. Full Support Healthcare have delivered training and education within the NHS for the last 10 years. We go out and deliver training on a daily basis into all manner of different trusts. We train people to actually cascade fit testing amongst their colleagues in their own individual wards and areas. And at the moment, I would say that we've trained over 50,000 people to become fit testers within the NHS.
How important is it that staff are given the correct RPE training?
Under COSH, every employer has a legal responsibility to protect their workforce from respiratory hazards within the workplace. So the new regulations that were released in April 2019 recommend that people need to be fit tested on a 2-yearly basis, but that may become more frequent if, for instance, their facial shape may change with regarding weight loss, weight gain, scars or moles in the area of the seal. Training is not just about the fit test itself. It's also about teaching the individual how to don the respirator correctly and also how to doff it correctly. Also to perform a pre-use wear a seal check each time a respirator is worn.
What about staff that have got beards or facial hair?
COSH and HSE now state that you need to be clean shaven on the day that you are fit tested and also the day that you wear the mask. So any kind of facial hair whatsoever, whether it be a beard, whether it be a trim beard or stubble, you cannot wear a tight fitting device. For those people and also people that don't pass a fit test, we can use what is called a loose fitting powered air respirator, which means that they can wear one of those and be compliant and also, more importantly, protect their own health and safety.
Whilst Full Support Healthcare are clearly market leaders at providing RPE to the NHS, what's particularly impressed me today is the training and education that they give back to the NHS. It shows that RPE is more than just a product to them. Furthermore, there are 900,000 frontline NHS workers, and their health and safety is at the heart of every decision Full Support Healthcare makes.